gentleman from California, Mr. Ruiz, is recognized for 5 minutes of questions. Dr. Ruiz.
Thank you, Dr. Bright. Thank you for your testimony here, and thank you for your service to our country. My heart aches for the family and friends of the over 80,000 in America who have died of COVID-19 in such a short period of time. In fact, my heart aches for those closer to me. The Riverside County has reported 228 deaths. As a doctor, I appreciate your written testimony that states that science, not politics or cronyism, must lead the way to combat this deadly virus. There's been a lot of hype about cures for COVID that have been shown to be ineffective and even dangerous. We are now seeing the very real dangers and consequences of not making decisions based on science. Hydroxychloroquine, which Fox News commentators and then the White House repeatedly touted and actually encouraged people to use, is Exhibit A on this list. But there is one drug that appears to provide some therapeutic benefit, remdesivir. 2 weeks ago, Dr. Fauci announced that remdesivir showed a clear-cut, significant positive effect in diminishing the time to recovery. My understanding is that in January and early February, you launched a comprehensive review to assess which existing drugs may prove a therapeutic benefit, and you quickly identified remdesivir as the most likely drug to be effective against COVID-19. Can you describe how you came to that conclusion, who you told within HHS, and what the response was?
So that conclusion came about by a technical review from a number of scientists within HHS, so the CDC, FDA, NIH, and BARDA. But it was also aligned with a scientific assessment from WHO and a number of global experts who rapidly looked at every potential drug and ranked remdesivir as the drug that had the most potential for benefit.
Who did you tell, and what was the response?
We shared that information with Dr. Kadlik. We shared that information within HHS leadership as well. We had discussions about the actions that could be considered for acquiring the limited supply of remdesivir.
What was the response?
And we had discussions about how to ramp up production of more remdesivir in case the randomized controlled clinical study that the NIH was conducting came through with positive.
And so you had a discussion, and what was the response? Did anything happen?
No decision was made at that time.
My understanding is that Peter Navarro, the White House trade advisor, reached out to you on February 7th to seek your counsel. You told him about your top 3 concerns: the shortage of N95 masks, the need for a quote-unquote Manhattan Project to develop vaccines, and adequate supplies of remdesivir. Can you tell us if Mr. Navarro agreed with you and what steps you and he took?
Mr. Navarro did agree with me on the remdesivir, the N95 mask, and the Vaccine Manhattan Project, and he drafted a memo on February 9th to the White House Chief of Staff and Mick Mulvaney to share with the White House Task Force.
The directive for HHS to act on remdesivir occurred on February 10th. What happened next? And did the department promptly procure the needed supplies of remdesivir?
We did not proceed with procuring any supplies of remdesivir.
Okay. You were removed from your position on April 22nd. By the time you were removed, had the department settled on a plan and procured the remdesivir?
No, sir. They were still discussing slide presentations about potential donations of remdesivir at that time.
So what you are describing is a gang that couldn't shoot straight, and yet we are in the middle of a pandemic. There is one drug the experts say could make a difference, and in fact has been shown to make a difference, yet the department can't seem to figure out how to acquire it. A week ago, the Washington Post published an article on the rollout of remdesivir, describing it as, quote, confusing, unfair, and marred with incomplete medical information, unquote. Doctors described how they can't obtain the drug and don't understand the process for accessing it. Dr. Benjamin Linas from the Boston Medical Center said, quote, there's no transparency. The process is just a staggering injustice. Dr. Bright, you were warning about this over 3 months ago. If the department had listened to you and the other experts at your agency, could this fiasco have been avoided?
We would have had a plan, sir. We should have had a plan for that drug and any other drug in limited supply.
So it didn't have to be this way.
Right.
Here's what I don't understand. You were right about the dangers of hydroxychloroquine. You were right about the benefits of remdesivir. You were right about N95 masks and other critical issues. Yet you got fired from your job while officials who botched the response and ignored your warnings stay in theirs. Not only is this unfair to you, it's completely dangerous to the American people. I yield back my time.
Gentleman.